Joe, you've recently concluded some research about diabetic children and their school life. This has shown that many of them are very self-conscious about their condition, that they perhaps even neglect their medication because of that, and can also be bullied by other pupils. One of your concerns about this is that there's just inadequate support in the school for diabetic children. What do you think we should be doing about this as a society in general?
Well, our research certainly identified that there was wide variation in secondary schools around the kind of support that was provided to young people with diabetes. And we know that self-management is absolutely vital in diabetes, and different schools were succeeding more or less in providing support for pupils to manage their own condition. So some schools were clearly providing fantastic support for the pupils who had the condition, whereas other schools, clearly the help and support really wasn't there. And we think that there needs to be some kind of more standardised policies around diabetes management within schools. Our research was undertaken really only from the viewpoint of young people themselves. So we think the first thing that needs to be done is to talk to teachers, to ask them about what's going on. You should note that in teacher training, there's nothing about medical conditions. So it's sort of unsurprising that teachers might not necessarily know anything about diabetes unless they have personal experience of it themselves, or they've had a pupil in the past with diabetes. They won't necessarily know anything about it. It's possible they might be scared of doing the wrong thing. It's quite possible, we suspect from some of the research we undertook, from what the young people were saying, that information systems that are supposed to be in place to be passing on information about people with diabetes in the class to teachers aren't working. So what we think we need to do now is to go and talk to teachers and school staff themselves about what they think is going on, about what they think would be helpful for them to do and what it would be helpful for them to know. And importantly, how they could implement that fairly easily into their everyday teaching practice. We don't want to be asking teachers to do something which it just isn't possible for them to do in terms of their current workloads. But we think that this sort of area really needs a joined up approach. It needs to involve young people with diabetes themselves, it needs to involve their parents, it should involve schools, it should involve health and social care professionals, it should involve education authorities, because we don't think that unless we have all of those people on board and we've listened to their opinions, that any kind of standardised protocols that are produced are necessarily going to be implemented terribly well. We think it's important that we've heard everyone and we take everyone's opinions on board before any kind of standardised, formalised policies are introduced.
So you're looking to do some more research into this problem. Mm-hmm. What you've talked about there is hopefully putting in place a national policies. Mm-hmm. Where do you start with something like that?
Well, we think to start with that, as we say, we need to go into schools and talk to teaching staff themselves. We absolutely appreciate that in secondary school settings it's very different to primary schools, so teachers don't have a class with them all the time who they become very familiar with. Pupils are going in and out of different lessons, they're moving around the building. So it is much harder to implement this kind of thing in a secondary school setting. But we'd like to really do some work, a kind of bottom-up approach on the ground, and talk to the people who are involved and see what they think they need and also how they think it should be implemented. We think that that's the way to get people to adhere to anything that is then introduced.
And one example of how to do it right was at a local school in Huddersfield, Almonbury High School. Mm-hmm. What type of things were they undertaking to help their pupils with diabetes?
Well, I quite specifically didn't ask Almonbury about their own policies, partly because that area of the research I wanted to talk to young people who didn't have any necessary prior knowledge. So I didn't want to find out from the teaching staff beforehand what they said was going on. I wanted to talk to the pupils and find out whether or not they knew that there were people in their midst with diabetes, and what they saw was being done about it, as well as going through some educational materials with them. But I know from talking to the teaching staff who allowed me access to those pupils that they were very aware of the pupils who they had. They were very aware of their needs, and I think that it's demonstrated even by the fact that they were so supportive of this research and that they saw a clear need for it, that they are very aware of the particular needs of their pupils with diabetes there. They seem to take a very sympathetic approach.
So it can be done?
Absolutely, yes, it can be done. I think as well the other thing that they had is they had knowledge of the condition, and this is not a teacher specific problem. There is not enough known about type 1 diabetes generally, nationally, and so some of this is about awareness raising as well.
The University of Huddersfield, inspiring tomorrow's professionals.